Welcome back, guys, to another episode of Hormones Happen. Today, I have a special guest. I know you guys get so tired of hearing me all the time. I have Anastasia, the owner of Invite Wellness, here with us today. Anastasia, hey, thanks for being here.
Thanks for having me.
Yeah, so Anastasia, I find this very interesting that you own a TRT clinic for men. You do treat some women with peptides, but give us some backstory. Like, what have you done? How long have you been a nurse practitioner? What kind of areas have you been in? And what got you to where you're at now?
Yeah, so it probably is interesting. Like, I'm a woman and in a very male dominated space, especially treating men's hormones. So I will tell you how I ended up on men's hormone optimization. So I originally started out with offering weight loss services to women through peptides, GLP-1s, things like that. And I found it very helpful. Now, men were coming also for weight loss as well, but I noticed that with men, the weight loss just seemed to be short-lived, and their biggest complaint was, "I'm just so tired. I'm so tired." And I'm like, "Look, you gotta get to the gym. You gotta be in a calorie deficit." And I would do all the things that I would talk to women about, and they're like, "I'm just not motivated. I'm not tired. Or I'm tired." And so, I at the same time, I was learning more about testosterone replacement therapy, and once I started implementing that, I just saw such a huge difference in the progress that men were making for weight loss and really just in how they were feeling. So, found that testosterone optimization can be positively life changing. And so I want to be here for it. I'm here for it. I want to offer the services. I want to offer the services in a convenient way, in a non judgmental way, you know, reduce the kind of red tape through insurance and stuff
Mhm.
like that. So, yeah, so for me, the biggest thing is just how positively life-changing TRT can be for men. So that's why I continue to do it. And I get to work with pretty incredible people. So,
Hell
yeah.
yeah, yeah. No, I mean, being on TRT myself, I can absolutely attest it is game changing. And, I hate to say as guys we're stubborn, but we're kind of stubborn, right? You're going to tell us to
Oh,
eat
of
healthy,
course.
go to the gym. It's like, come on, lady, what do you think I've been doing, right? Even if we're not, right? But then you give us some of that testosterone, and now all of a sudden our mind changes, right? A lot of people think, oh man, all the physical benefits, the mental benefits, that's huge. Because then I'm actually motivated. I want to go to the gym. I like to see what's happening in the mirror. It motivates you to push even further. Now, with that being said, like being a female, do you find it any specific obstacles in treating men? Do they say anything? Do they withhold information? Do you ever notice any of that?
So I've actually been pretty lucky with my patients being very open with me. At least, the information that I need, they tell me they're pretty comfortable explaining things to me about, sexual function, because that is something that we have to discuss when we're tracking testosterone replacement therapy progress. The men that schedule with me, I think they don't have an issue with me being a woman. I think the people that do have an issue with it don't even book that first call. So I already know that if the guy's scheduled, he doesn't have an issue with me being a woman. Also, another thing that I've noticed is I offer telehealth, right? So you don't have to come into an office. You can see me as long as you have, video access through your phone or
Sure.
whatever. And one of the things that I've noticed is, and you can tell me if this is something that you've noticed as well, is that guys just don't like going to a doctor's office.
We
and
hate it.
right. So one of my first questions is, do you have a primary care provider? Because although I can manage your hormones, I can optimize you, still, you should have a primary care provider so they can manage your chronic conditions. And oftentimes guys will come and they're like, I haven't been to a primary care in like, you know, so
Yeah. Yeah.
so I'm glad again to be accessible for those type of people and make it comfortable for them to access care. But to answer your question, as far as does being a woman make it difficult for my patients? I don't think so. I think maybe even some people prefer that. No one ever actually
Mhm.
said that. But again, if they already make the first move to schedule, I think they're past this. Oh, she's a woman. What's she going to know? My OBGYN that delivered the kids was a man. I'm not going to say, what do you know about? being pregnant. What do you know about,
Right.
being a female? Like it's about the message, not the messenger sometimes. I'm just a
You know,
mess I'm just a messenger that happens to be, my avatar is blonde hair, whatever. And just
there
listen to
you
me.
go. There you go. And we don't care. I mean, the surprising thing is guys don't care. And me treating women, women don't care either. If you're going to help someone, they just want help. They do
Exactly.
not care. It is so far and few between. To be honest, I would prefer to see a female myself, right? Most guys would, contrary to popular belief. Now,
Right.
telehealth, super convenient. That's awesome because everyone loves telehealth. That's the future. You don't see a lot of brick and mortar clinics, especially not clinics like ours that are specialty, right? You don't have a brick and mortar location with a sign that says, hey, TRT, testosterone. Some guy walking by happens to meander in. Doesn't happen, right? We're telehealth. We have to do the marketing through traditional marketing pathways online. That's where people find us because that's where everyone's at is online. Now, what would you consider to be some of the biggest barriers to someone getting treatment through, like, let's say their primary care provider?
Well, first of all, insurance, right? And then, so that's going to be the first thing. So typically, when you go to a primary care provider, you are using your insurance to cover the cost of that visit and also to cover the cost of treatment. And with testosterone replacement therapy, there are insurance guidelines that say you can get treatment if you fall within a certain lab range. And then beyond that, you can only get treated through this specific modality or this specific administration like gel or cream. Like you can't do injections or, you're within the you're in the you fall below the range, you can move forward with treatment, you can do injections, but you can't do more than 200 milligrams every 2 weeks, whatever. So the first barrier is that insurance is now stepping before the provider and basically determining if you need treatment or not. And that is just incorrect, right? You want the provider that's assessing you to say whether you need treatment or not the insurance company. Okay. So
Right.
that's first things. So going to a place that accepts self pay, you now aren't bound by these insurance guidelines. And guidelines is what they are. You know,
Hmm.
even beyond the insurance, of course, there is guidelines on how to approach any, clinical presentation, including hypogonadism or testosterone replacement or low testosterone and testosterone replacement therapy. But that is the thing. They are guidelines. They aren't, this is exactly what you have to do for every patient. In that case, just type up a cookbook for TRT and, guys who have to go to a provider, they can just read it and do it themselves. So it's the other barrier about, going to primary care is such an important specialty. It is a specialty.
Hmm.
People might
Yeah.
not
Yeah.
think, but
Absolutely, it is.
primary care is a specialty and it's so important. They manage and juggle so many chronic conditions. They're following up, they're referring, they're sending to specialists. They're looking at your chronic conditions, your pre-diabetes, your thyroid, all of that. They're managing your blood pressure, they're managing your cholesterol, and they're doing all of it. Testosterone replacement therapy is just, first of all, it's a hassle with insurance.
Hmm.
And unless you are actively, as an individual, as a provider, seeking out continuous knowledge on testosterone replacement therapy, you're just not going to know how to do it. And the only thing you're going to have to go off of is these recommended protocols, these guidelines, you know?
Yep. Yep.
And so oftentimes guys will say, I went to my primary care and, he saw that I was below the range and he put me on gel or he put me on, 300 milligrams of testosterone once a month. Or sometimes guys will complain and say, I went to my primary care provider. He said that I'm below the range, but he said he's not going to treat me. Good.
Hmm.
Good. I would rather have this person that doesn't know much about testosterone replacement therapy not treat you so you can go to someone else. If you come to me and you want me to manage your type 1 diabetes, I'm going to say no thank you. Like I'm not the person. Go to a diabetes specialist. So To the guys that go to their primary care and they are told by their primary care providers that although they are a candidate for testosterone replacement therapy, primary care is not going to treat you, good. Use that and go somewhere else. This is an honest answer from a provider that understands their knowledge based limitations. Good.
Yeah, absolutely. I mean, coming from primary care, I can attest that all the things that we do in primary care involve decision making trees. I'm sure you've heard of Up to Date. Up to Date is a database that we use that has all of these research guidelines in it. And it's reality. You type in hypogonadism, it's going to give you a decision making tree. Now, unfortunately, you're going to fall through like antidepressant, 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 and then maybe check hormone levels. It's not good by any means. But you're not able to think autonomously because you have to appease insurance. So even though you know, hey, this guy's being horribly managed, there's nothing you can do about it. Insurance is the gatekeeper, right? Not just to mention that, but then also, like you said, the formulary, Androgel, very underpowered, alcohol based transdermal testosterone replacement, right? Comes at like 1%, 1.62%. I don't see a lot of guys get great results from that. And then, of course, the crazy outdated protocols 200 milligrams every 2 weeks. Nuts. These guys feel even worse because we're turning off their natural production and then they're just crashing before their next injection. It's absolutely horrible. So, like, with that being said, like, what kind of protocols do you like as far as your testosterone? Do you do like once a week, twice a week? What are your thoughts on all that?
Yeah. So I will tell you let's start off with the first deciding on the first dose. So, as you and I just talked about, there are recommendations, but the reality is there really isn't any specific dose that everyone should get on. Not everyone is getting 200 milligrams once a week. Not everyone is getting the same thing. So, as a provider that specializes in testosterone replacement therapy, one of the things that you do is decide on a dose. Now, since there isn't like everyone starts on this dose, you have to basically determine for your patient because it's a personalized treatment you have to determine, what dose do you think is going to work for them. So, how do you figure? Right. So, you obviously have to look at the person's height, weight. You have to take into account their body composition. You have to, take into account how they're presenting as far as their sleeping cycle. Are they sleeping? Are they a night shift worker? Things like that. And obviously, baseline labs. Right. So, here's my approach with picking a dose. My goal when we first pick a dose is to pick a dose that I think will increase your testosterone levels appropriately, right? Now, there's these clinics that do something like everyone gets, 200 milligrams once a week. And obviously, at 200 milligrams once a week, for the most part, you can suspect
Not
that their
great.
testosterone levels are going to go up, right? However, that's not always a good thing, right? So you can put someone on a really high dose and you can know that their testosterone levels are going to go up for the most part. Now, everyone responds to a dose differently, but we can suspect that a certain dose is going to bring testosterone levels to a certain place. So, starting someone on a high dose, there's a safety net of knowing, yeah, their testosterone is going to go up. But sometimes what happens is you start a guy that has a baseline testosterone of, let's say, 250. Let's just talk about total testosterone to keep it simple.
Sure.
He's 5'10, 175 pounds. You put him on 200 milligrams once a week of testosterone cypionate. Yes, testosterone levels are going to go up. But when you come back in 3 months to adjust your protocol, because it is a dialing in process, let's just say the dose is too high. Not only are you going to have to adjust the dose, you then have to deal with side effects that come
Hmm.
shooting testosterone levels up too high too quickly. Even if, let's say you have a crystal ball and the crystal ball says this guy is going to be optimized at, 250 milligrams split twice a week. You still don't want to start there. You want to work your way up there because, again, going up too high, your body's like, whoa, 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 a lot of adjustments, a lot of, hormone coming in.
Hmm.
And then you sometimes have to deal with side effects, red blood cell spikes, water retention, blood pressure might be going up, things like that. So,
Acne.
yeah, yeah. And then, the opposite of that, and so usually the high doses right away come from, like chain TRT clinics, but then you get providers that aren't versed in testosterone replacement therapy, and as you know, our approach is always start low and go slow with
Yep.
any medication, and so you'll get a guy that, you know, comes from primary care, urology, endocrinology, which by the way, like I said, very important, specialties, but
Sure.
TRT is just not at importance to them. So they'll get put on like, 80 milligrams of testosterone, and then they come back and they come back to get dialed in for their follow-up for dose adjustment, and their testosterone is even lower. So now they're in a synthetic testosterone deficiency. So you don't want to start too low, you don't want to start too high. You can suspect that a certain dose will reach a certain goal on labs. It doesn't always happen, but you can, at least suspect. To answer your question, my approach is usually somewhere between 120 to 160 milligrams split. Typically, it's 120 to 140. I would say that's more
Mhm.
common. Split twice a week. And then you come back in 3 months and we see what that does for you. But it's
Oh
a
yeah.
dial process.
Right. I love it too. I love the dosage too, because what you're saying that not every guy should be at 200. What you're saying is 200 is not the cap. Some guys respond better to doses over 200 a week.
Yeah.
Is that what I agree 1,000%. And so typically what I'll do, and there are some factors, is I do exactly what you do. I start them low at typically 25 units twice a week. Every 2 weeks we increase by 5 units, and we keep climbing. And once we get to 50, we say, well, hey, how are you feeling? How's blood work look? And then from there, it's like, still not feeling great? Let's keep going, right? I'll treat all the way up to 280 milligrams a week, right? Now, with those doses, sometimes you do run into some issues. When I was at 280 a week, acne was a real problem, right? So it was just like, what a freaking headache. Sure, there are things you can do to help mitigate some of the acne. Some of it includes using different types of carrier oils, of course, preventative skincare. But I found that even at a lower dose, maybe about 210 a week, I felt just as good as 280, and the acne was gone. And sometimes, with guys, we think more is better. It's like, oh my God, I feel so amazing at 200 a week. What would 220 feel like? And, you kind of have to say, it's probably not going to be much better. At some point, the risk of side effects are going to outweigh the benefits when we're optimizing, because we never know what an optimized dose for someone is unless they got their hormones checked when they felt their best. No one does that, right? We don't get our labs checked till the check engine light's on. That's when we're like, I need to get this checked at. And for us guys, we're even worse. We'll go 10 years with anxiety and depression and just say it's 1,000 different things. As soon as the penis stops working, medical emergency. We need to be seen today, right? And so it's just like trying to play catch up. And I see it all the time, patients who are treated through insurance, just the crazy doses, super low doses, super, infrequent time frames. It's just like these poor people. You're worse off sometimes being approved for insurance because you have to play by their rules.
Yeah.
Now,
Yeah.
are there specific like levels you look for? Like, are there specific levels you aim for with your guys?
So, yes and no. Obviously, the biggest thing is for the guy to experience symptom resolution from those low T symptoms. So, whatever he came in with, I'm tired, I'm falling asleep after lunch. My wife is hot, but I kind of don't, want to pursue like just
Sure, sure.
very typical things that guys usually brush off. And we can talk about that is a barrier to care for men, but so we dose, we dial in until their symptom resolution. Some guys feel better with their testosterone in the 700. I've seen guys feel better with testosterone in the 600s. Seen guys feel better with higher ranges,
Mhm.
1300, 1400,
1,500. Yep.
1500. And so we don't aim for a specific number. However, I am comfortable, and well, I have noticed that most men feel their best somewhere between 900 and 1200 on the total testosterone
Same.
level. Um, and then, obviously with free testosterone, as soon as they get over that 20 of free testosterone, they're just like, yeah, I feel better. Between 20 and 40 on the free testosterone and between 900 and I would say like 1200 on the
Mhm.
total is when guys really start is when they, experience that symptom resolution and they feel better. Again, some guys feel better way before then, and then some guys just need a higher dose. And, a lot of times people are like, oh, that's too high. Symptom resolution is what we are aiming for. And
Yep.
you document symptom resolution at these levels. And that's just the reality. So
Yep.
that's what
Agreed
it is.
1,000%. There is no critical danger level of testosterone, right? It's not like a super high level of potassium where we're now worried about your heart. There's no critical level of testosterone that says, hey, man, you're going to die in like 5 minutes if we don't do something. It doesn't exist.
Yeah,
We're looking at the whole picture. Of course, we're checking all these other systems as well. And the goal with optimization is to make you healthier than you were before, right? Because we're not saying replacement, we're saying optimizing for a reason, because replacement just basically says, we're making you functional. We're just getting you within this parameter set by, population based studies. Or no, optimization, right? We're giving you the best quality of life that we can, right? Would you agree with that?
absolutely. Absolutely. But this also goes back to what you were saying about, a guy is like, oh, well, if I feel good at 200 milligrams, I'll probably feel better at 220. And that really is not always the case. There's been plenty of times I've had, guys transfer over and they're on these ridiculously high doses and, they're having erectile function issues, other issues. And I'm like, let's just take it back a notch on the dose, and of course they feel better. So with testosterone, more isn't always better. Again, back to it dialing in. It's a personalized approach. It doesn't matter if the guy, down the street feels good at 250 milligrams of testosterone. You might feel good at 120. I always tell guys, forget what the other guy is doing. Okay. He's not
Yep.
living in your body. You're living in your body. So let's focus on how you feel. Um, and then, as far as like, sometimes a guy will be like, "Yeah, I feel great. Everything's amazing. His labs look good." And, I like to approach my TRT care. What is that called? Shared approach,
Joint decision making process.
joint decision making process. So I'll explain what I see. I'll explain, what my suggestion is, and for example, I'll say something like, okay, I feel like you, or I can see that you have symptom resolution. Your labs look good. You report that you're feeling
Hmm.
great. I say let's keep things the way that they are, and this is usually where I would say a guy is optimized, and then I'm like, let's see each other in 6 months versus every 3 month follow up. And then he'll say something like, "Yeah, well, what if we increase the dose a little bit?" My next question is, for what? You
Hmm.
just said how
Yep.
amazing you feel, how motivated you feel, how much progress you're seeing. Your labs look good. Like, what is the goal? And the answer is always, well, I don't know. I mean, if I feel good now, can I feel better?
Why not? Yep.
Yeah, yeah. And so, then you have to explain what exactly is testosterone optimization. Testosterone optimization, again, is to get you feeling better, for you to have symptom resolution from those initial issues that prompted you to even seek out this type of therapy. Testosterone optimization is you have resolved your low T symptoms. You're now feeling motivated. You're feeling more confident. You have better posture. Yes, this is an
Yep.
effect of optimal testosterone. You have better posture. You have a bigger
Confidence.
confidence. You have a bigger capacity to deal with stress. Your sleep is improving. You're seeing better results at the gym. You're able to put on muscle. You're able to lose fat a little bit easier. Your libido is optimized and healthy, which is so important for a man. Sometimes I'll have guys in their I'm kind of going off topic, but sometimes I'll have guys during their evaluation, I'll ask, do you experience morning erections? And they're like, no, but that's not an issue. What? Excuse me?
That's a big
No,
issue.
this is, like we have this life. You're living in your male body. Like this is one of the benefits, pleasures of life. Like get
Absolutely.
your morning erections. It is
Absolutely.
important. It is
Erections are important to us.
whoever
Yep.
told you it's not important
That poor, poor
stop
guy.
listening to them. As a man,
Abs-
you will feel better, you'll feel more confident, you'll be more sure of yourself. Please.
Absolutely. And sometimes we have to be like, okay, we have to temper expectations because there is going to be a little bit of a honeymoon phase with
Yeah.
this where, your body's being introduced to all these androgens. Your body's like, oh my God, I love this. But you got to realize you're still going to have stressors of life. It's not the panacea to all your problems. You're still going to have sadness. You're still going to have anger. You're still going to have all these other emotions and problems that go on through life. And sometimes you might say, it's easy to blame the medication and say, hey, this dosage isn't working because I'm still getting sad. Well, guess what, man? You should be getting sad. Everyone gets sad for some reason, right? It doesn't stop you from having any negative feelings. You just got to be able to work with it. And it gives you tools to be able to navigate these situations a little bit more effectively. But I see it all the time. Guys are real quick to say, hey, I don't feel like I did when I first started. I think we need to make a dose adjustment. It's like, no, 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 no. I don't think that's the case. I think we just have to realize that, hey, you feel better than you did before. If you were to stop this, think about how you would feel, right? Sometimes it's hard to see how far we've come when we have this new, I guess, baseline. Does that make
Yeah,
sense?
yeah. So I agree with that, but there's a little bit of a difference there. So there is something that goes on with that honeymoon phase. I feel like the honeymoon phase is more intense than what guys when they say felt great in the first 3 months, but then, like, after that, I went from, like, a level 5 to a level 3, for example. In that case, sometimes what happens is when you start on testosterone replacement therapy, you've got your natural production, and then you've got your exogenous testosterone, and your body's getting it from both ways, and you're like, "Wow, I feel great." And then
Sure.
after, weeks in, a few months in, your natural production goes down, and now you're dependent just on this exogenous,
Hmm.
testosterone, and therefore you might not feel as great. Okay, we do a dose adjustment. Maybe we add some HCG, to promote that natural production if it's appropriate for you. But you're right. When the guys that have been on testosterone for, 2, 3 years, everything is great, everything is going good. And then an issue comes up and they're like, oh, it's the testosterone. Well, why all of a sudden is it the testosterone and not anything else?
Sure.
Why all
Yeah.
of a sudden did it stop working? It's usually not. But the truth is that providers, uh, you know, primary any other specialty that isn't the person actually prescribing the TRT, providers and patients like to blame a lot of things on
Yeah.
TRT.
Oh,
you
yeah.
know,
Always. That
mood,
poor scapegoat.
physical things, everything.
Roid rage, prostate cancer, hair loss. I mean, come on, guys. The fallacies continue. It's just crazy. Testosterone is just a poor whipping boy of, the
Yeah,
medical issues. And the thing is, there are well documented studies that tell us all the amazing benefits of it. Its protective effects on the heart, right? Like, guys, don't listen to the propaganda, but unfortunately, it's out there, right? Big Pharma is going to push it, of course, because there's a lot of money to be made with all these downstream complications, diabetes,
absolutely.
hypertension, hyperlipidemia. When we can prevent it, why? We're not a preventive society. That's not the way that medicine works in the United States. We're very reactive. We're not proactive. But you made a good point about that transition period where you're making endogenous and exogenous forms of your hormones, which just means your body's making natural hormones, plus you're getting it through your injections, creams, pills, whatever. Because there's a lot of different metabolites that are made from those endogenous hormones. So you're kind of getting more bang for your buck. And what I've heard is that, for instance, like let's say a level of 700 total testosterone endogenously is essentially better, you feel better than an exogenous level of 700, just because of all those little metabolites too. So that does make a lot of sense of what you said. And I have a lot of guys on HCG, not for fertility reasons, that feel significantly better.
Yeah.
They just tell me, I feel way better. I've never tried it, but it makes sense, right?
Yeah. Yeah. HCG is very interesting because, clinically speaking, the indication for HCG in men is to maintain natural production for the purpose of maintaining fertility. Which, side note, I have guys on TRT that get their wife that have gotten their wives pregnant, not on
Same.
HCG, not on anything else. So to if anyone's listening and thinks that testosterone makes you sterile, it doesn't. It can reduce fertility by reducing your natural production, but it doesn't make you sterile. And I always tell my guys, please use protection if you don't want to get pregnant, okay?
Yes,
Because
it's not birth
otherwise,
control.
exactly, otherwise it would be, marketed as birth control. But so with HCG, now most guys are just on TRT, but some guys are on HCG. And like I was saying, the clinical indication is to maintain natural production to, optimize fertility or, keep the tap open basically.
Mhm. Sure.
Aside from that, HCG is very helpful in other things. Guys that have decreased sensitivity in their difficulty reaching climax, their prolactin
Mhm.
is good, but they just feel like it's taking forever. They're like 45 minutes in, the girl is like, back off. It's like we
Yeah,
need some help. So
poor guy.
HCG, anecdotally, which means guys have reported that,
Mhm.
yeah, HCG does increase penile sensitivity, maintaining or restoring testicular volume. Most guys don't care that their testicles reduce in size. Also, there's
Nope.
this big myth, and I actually see it in comments like on social media all the time about, oh, your nuts are going to turn into raisins or peanuts.
Mhm.
No, they're not. It is not that extreme. Okay, they may
Not at all.
reduce in size a little bit, and oftentimes, unless you're feeling around, it might not even be noticeable. So, most guys don't care about that, but some guys do, and that's okay. You know, you want to feel confident in your body. If you like them a little thicker, we'll add
There
HCG.
you go.
Not a big deal. Not a big deal. So there's that. Some guys do experience increased semen volume. Again, do you need it? Unless you're, maybe for fertility.
Sure.
Some guys just like it. They
Of
like a
course.
full load.
I can understand that. I can understand that.
With all of that, so there's these reasons to add HCG. As you were saying, some guys just say they feel better with HCG added to their protocol, and they don't have any of these other reasons to add it other than, I don't know, I feel better with it added.
Sure.
Fine. And
Just do it.
that's the beauty of working for the patient and not for the insurance company.
Amen.
That's the
Yep.
beauty.
Absolutely.
We can provide care as long as it's clinically safe. If you want to add HCG or another peptide, like I said, as long as it's clinically safe and you get benefit from it, I'm comfortable moving forward. At the end of the day, it's how
Same.
you feel in your body. So
Absolutely. Now, Anastasia, what do you think about HCG as monotherapy? I do see some people use HCG as monotherapy. In my personal experience, I haven't seen that be a great long-term solution for any guys. But what are your thoughts on it?
a big fan of HCG for monotherapy. I actually don't prescribe it. I've never come across, a situation where only HCG was needed. But also from what I understand, it kind of caps on what it can do for you. Now, knowing how HCG works, knowing that it mimics luteinizing hormone, if a guy naturally, right, has suboptimal testosterone and you're not adding exogenous testosterone, you're only adding the signaling hormone, which is in the form of HCG, then really it's only going to increase your testosterone at the capacity that your body can naturally produce it. You know,
Sure.
Adding exogenous testosterone, you can really, you can take your testosterone levels to
Limitless.
the ranges. So, as far as HCG for monotherapy, I don't prescribe it in that way. It's always an adjunct therapy for the reasons that we talked about.
Sure. Yeah. I mean, it makes perfect sense. I mean, you can only make so much testosterone from the testes. And if you've got hypogonadism, low testosterone, like a primary hypogonadism, the issue is the testes themselves. Guess what? You can signal those bad boys all day. They're not going to work any better. You're wasting your money, So I agree. At the end of the day, let's just go testosterone, guys.
Yeah.
It's people think it's like a stepwise approach. So, like, okay, this is safer, right? Which the reality is, I mean, testosterone's more natural than HCG. It's more natural than enclomiphene, Clomid. I mean, we kind of get things backwards when we say, I want to increase my natural testosterone. There's nothing natural about those medications, guys. Testosterone, bioidentical. Guess what? Your body already has it in you, right?
Yeah. Yeah.
But
For sure. For sure. Absolutely.
so, Anastasia, you're also licensed in several other states too, right?
Yeah.
Which
Yeah.
states are
So,
those?
it's 8 states right now, and actually, I'm working on two other ones. The third one is still in the works. So we do Arizona, Nevada, Colorado, Iowa,
Wow.
West
Okay.
West Virginia, Delaware, Maryland. I think that's 8. Is that 8?
I
Florida.
That's a mouthful. Florida. Okay. Well,
Yeah.
Florida isn't Florida a restrictive state for
Florida
NPs?
is a restricted state unless you apply for the telehealth only license, and then
Oh,
you
heck
can
yeah.
under your so with the telehealth license in Florida, you are practicing under your home state scope of practice. But yeah, it's a totally separate license. The whole licensing thing, I feel like it's such a
Pain in the
hustle.
ass.
It's
Yeah.
such a hustle. They're trying to make their money. I get it. I get it. But
Yeah. It's
yeah,
a
with
pain.
Florida is um also, there's that map for, autonomous states,
Yep.
full authority states, and then not. That green, red
I do.
map?
Yep.
Okay. I used to think that map was so correct. It is not. It's not. There's so many states that are red and yellow that after a few years of practice, autonomous. So
Absolutely.
you got to do a little bit more digging. Virginia is one of those states.
Okay.
Yeah. So you really got to do a little bit more digging, but
You should really add New Mexico on there. It's probably the easiest state to get licensed in. No
really,
background, no fingerprints. Just pay them like what, $60? You're ready to rock and roll. Piece
I
of
feel
cake.
like Colorado was the same way.
Colorado is too. Colorado is very, very chill about it. Yeah, yeah. But some of those states were pain in the ass, man.
I feel
Arizona,
like yeah, I
Arkansas.
feel like Colorado, I just, like, filled out an application and they're like, "Congratulations." I'm like, "Oh, okay."
We need help. Come on
Meanwhile
over.
yeah, yeah, meanwhile, other states are just, you gotta get your RN first, and then you gotta apply for the other one, and
Yup.
it can take a long time, but
Tons of fingerprints. It's just
how about you?
unnecessary stuff.
What states are you in?
Oh man. Well, I'm licensed in 10 total. I'm pretty sure Arizona, Arkansas, Wyoming, Washington, Montana, I think. I don't know them off the top of my head, okay? You
Okay.
start to lose track of them all after a while. It's like, oh shit, there's so
Yeah,
many of
yeah.
them.
But it's good to
Yeah.
know because, especially like in social media, guys will be like, "Do you treat in,
Oh yeah. Yep.
Wyoming?" No, I don't, but I always like to, direct them to someone that
Right.
does. Um,
Right. Oh yeah.
so
Get that all the time.
yeah, so
TikTok.
good to know some of your states. Just send
Yeah.
me the rest of them.
Absolutely. Yeah. I mean, the reality is like that's the future. Like they're going to open up all these states for us nurse practitioners because why not? Why make this so difficult? People need help, people need care. And honestly, sometimes it's just like why they're putting up unnecessary barriers. We don't need those. You know what
Yeah.
I'm saying? But hey, so Anastasia, I try to keep these episodes a little short. It's been absolutely phenomenal talking to you. If you just want to spend like a couple minutes just telling us how people can reach out to you, how we can contact you. And of course, I'll have links to your social media and the website in the show notes too. So please.
Absolutely. So it's super simple to schedule. First of all, you go to invitewellnesstrt.com and there's a self-scheduling link. You open the calendar. Also, my information as far as like what we offer, as far as pricing, that's all on the website. It's very transparent. So go on the website, invitewellnesstrt.com, click on the testosterone replacement therapy tab, and you can find more information there, more frequently asked questions. And then you can self schedule from there. Obviously, you can always call us. You schedule your appointment. We do an initial medical evaluation. And let me just clear up what that is and why this isn't a consultation. So, a consultation, you have some questions, give us a call, send us an email, we'll talk. But a medical evaluation is this is going to be your first visit. We talk about your medical history. We see if there's any immediate contraindications. okay, to you moving forward. We talk about the medications you're on, we talk about your lifestyle, we talk about your sleep, which is important when it comes to TRT. We talk about your current symptoms. And then we order a set of labs and we determine if you are even someone that could even benefit from this type of therapy, right? And then you go get your labs done, you come back for the follow up, and if your labs reflect your symptoms, we can move forward with initiating TRT or not. And if we do move forward with TRT, then it's during that visit that we talk about possible side effects. We talk about what to expect and when to expect it as far as symptom resolution. We talk about injections, dosing, protocols, follow up visits, follow up labs, all of that. But if you guys want to, schedule your first visit, it's during that visit that we really get the foundation down to see if you're even a candidate or someone that could benefit from this therapy. So yeah, invitewelltrt.com. You can self schedule from there. And then as far as socials, I think you said you were going to link them. I'm usually on Instagram or TikTok.
Very cool. Well, thank you, Anastasia, for joining us today.
Absolutely. It was really nice talking to you. I'm glad we had this talk, and hopefully the
Yeah.
listeners got plenty out of it.
Oh, I'm sure they did. They love this stuff.
Okay, great. Awesome.